Good morning, dear colleagues. I'm Dr. San Juan from the Virgen Macarena University Hospital from Seville, Spain. The title of our study is Pillcam colon versus colonoscopy in the assessment of patients with ulcerative colitis. The other authors are Drs. Romero, Caunedo, Castro, Argüelles, Gómez, Benítez, and Professor Herrerías. The Pillcam colon capsule endoscopy enables the study of colonic disease in a safe and non-invasive way. Up to this date, the available studies have focused on the colon capsule endoscopy accuracy to diagnose polyps. However, there is not evidence of its usefulness in other colonic processes, such as ulcerative colitis. The primary objective of our study were to assess the correlation between colon capsule endoscopy and the colonoscopy in the extent and degree of activity in patients with known diagnosis of ulcerative colitis, and to evaluate the usefulness of the information provided by the colon capsule endoscopy in the patients studied. The secondary objective was to assess the capacity of the colon capsule endoscopy for the complete study of the colon in patients with ulcerative colitis. The method used was a single-blind prospective comparative study, in which up to this date we have included 22 patients, 6 females and 16 males, an average age of 46 plus minus 12 years, with diagnosis of ulcerative colitis confirmed by biopsy. All patients were first subjected to a colon capsule endoscopy and after 10 hours to a colonoscopy with conscious sedation, midazolam 2 to 5 milligrams intravenous. We used the standard protocol for colon capsule preparation. The activity of the disease was assessed by the Mayo scale, as you can see in this slide. The extent of the disease was assessed by the Montreal scale, as shown in this slide. We achieved a complete study of the colon in 19 out of 22 patients with colon capsule endoscopy, and in 18 out of 22 patients with colonoscopy. This means no statistically significant difference. The reason of incomplete examination in the case of colon capsule endoscopy were: in one patient, ileal stricture; in another patient, the battery ran out in the sigma; and in one patient, the capsule stayed in duodenal diverticulum. The incomplete colonoscopy were due to intolerance by 3 patients and colonic stenosis in 1 patient. The statistical analysis showed a match described as very good between the 2 techniques in terms of severity and extent, with a kappa correlation of 0.91 in both, and standard error 0.08. Additionally, the ability of colon capsule endoscopy to assess a broad segment of distal ileum allows to change the diagnosis of ileocolonic Crohn's disease in 2 patients, 9%. Our conclusions were: the study by colon capsule endoscopy allows an assessment of the severity and extent of ulcerative colitis comparable to the obtained by colonoscopy. The ability of the capsule endoscopy to assess distal ileum is another advantage of the colon capsule endoscopy, because pathological findings at this level can change the original diagnosis of ulcerative colitis. Thank you for your attention.